Chapter 3, Ethical and Multicultural Issues in the Human Services. What and why are ethics necessary? Ethics ensure that clients who seek help from human services providers are treated with respect, dignity, and honesty. Ethics is standards of conduct agreed upon by a group of professionals that are vital to appropriate and effective interventions. There is some basic overlap between the various human services disciplines. However, ethical issues usually refer to moral imperatives, the shoulds and the oughts, directed towards protecting the welfare of those who require services. Why are ethics necessary? Ethics are necessary to protect clients, protect workers in lawsuits, and prevent internal bickering. National Organization of Human Services was created for graduates and for students of mental health and human services programs. It started in 1972. The name was revamped in the 1970s and later in 2005 returned to its original and current name. Shortly after the National Organization of Human Services was developed, an accrediting organization was then formed called the Council of Standards in Human Services Education. This council has created standards that guide human services training programs nationwide. There are 5 ethical issues that guide most human services professionals. And the 5 issues are confidentiality, dual relationships, self-monitoring and self-examination, ethical competence through continuing education and supervision, multicultural competence. Confidentiality. Siegel defined confidentiality as the freedom of individuals to choose for themselves the time and the circumstances under which and the extent to which their beliefs, behaviors, and opinions are to be shared or withheld from others. This is meant to reassure clients that they can speak freely without fear that their confidential information will be disclosed. The legal counterpart to this ethical concept of confidentiality is referred to as privilege. Privileged communication in professional relationships require mutual trust, such as that between client and attorney, therapist and client, doctor and patient, and priest and church members. To break confidentiality may be related to unprofessional conduct. This may be subject to disciplinary action, suspension of a license, or for a person to take a mandatory education course. The Health Insurance Portability and Accountability Act, also known as HIPAA, includes 4 components that aim to streamline communication among healthcare providers and afford patients more rights. The first component, privacy requirements, creates rights for patients concerning how their health information is used and disclosed by healthcare providers. It also limits what a healthcare provider can do with a patient's health information without the patient's knowledge and consent. There are exceptions to the confidentiality and ethical standards. The mandatory reporting standards from 1974 and later amended in 2003 requires that may include social workers, teachers, counselors, therapists, child care providers, and healthcare providers to report child, elder, disabled abuse. If a client is in danger to self or others, so we have a duty to warn and we must report if someone is endangering themselves. You can also break confidentiality if a client is in danger to themselves. This is to prevent a person from committing suicide. You can break confidentiality if you are court-ordered or subpoena, or there's investigation into the death of the client, and you should release the client's information if they signed for it. In addition, the Patriot Act of 2001 is federal legislation that prohibits disclosing to clients that the Federal Bureau of Investigation, the FBI, was sought or obtained personal books, records, papers, documents, and other items of clients, as well as requires that such items be provided to the FBI. Dual relationships. Human services workers should maintain clear boundaries with their clients about the nature of the relationship. This means human services workers need to keep the relationship with the client strictly professional, and the sole purpose of the relationship should be to help the client meet his or her needs. Dual relationships mean that the human services workers and the client include 2 or more types of relationship, and this is strongly discouraged and sometimes illegal because it can lead to manipulation of the client and an exploitation of the client. For example, Human services professionals should not have sex, develop friendships, attend family gatherings, do business, or attend social events with their clients. Transference versus countertransference. Transference is when a client attributes qualities and emotions to the helper based on interpersonal patterns experienced with significant others from his or her past. For example, the client is having a reaction to the helper because they remind them of their parent or grandparent. Countertransference is a redirection of feelings, attributes, emotions from the human services workers to the client. Values and need to self-monitor. Human services workers should be aware of their own values. Values usually serve as an internal guide for how to behave and feel about life situations. Human services workers must be aware of their own values so that they do not force them on their clients. No one can be completely free of all biases and values. Ideally, human services workers should work on developing the self-awareness necessary to identify any tendency towards dual relationships and other propensities to ignore ethical responsibilities. A human services worker should not impose their values on a client, but allow a client to identify their own values. Sharing your own perspective may help client in broadening their perspective, but it should not influence the client's development of their values. When sharing your opinion with a client, help him know that it is your personal perspective and allow room for the client to disagree. Finally, if human services workers cannot ethically serve or assist the client, they should refer them out or consult with someone to help them deal appropriately with the client. Human services professional can gain self-awareness through counseling, consultation, reading books, going to workshops, or continued education. As work becomes more and more challenging with many clients, it is important to avoid triggering the multitude of countertransference reaction. Ethical competence and continuing education. Ethics also requires that professional workers participate in training and education beyond that received in a formal education institution where an actual degree is earned. Many professional association requires 30 to 36 hours of continuing education every 2 years to renew your licensing. Attending conferences or workshops can result in renewed feelings of motivation and challenge, and it also helps to avoid burnout. Continuing education allows professionals to keep up to date on new issues, new treatments, trend changes, and clients bringing diverse challenges. Attending conferences, reading books, magazines, journals can help you learn an agency's specific methods of treatment and intervention. And again, these are not always taught in the school system. Ethical standards also encourages consultation. Failure to provide competent service because of supervision, consultation, or training was not sought may be grounds for malpractice lawsuits. When in doubt, seek extra knowledge and consultation. Multicultural competence. Although many human services practitioners would like to think that current human services agency offers services free from political and cultural bias, this is not always true. Cultural bias is judgments based solely on a person's background and ethnicity. It is difficult to have agencies operate from a completely unbiased practice. These biases may take on either obvious or subtle forms of discrimination, such as disparities in services, preconceived notions, stigma about certain populations, and reinforcement of learned helplessness in some populations. The theories and interventions in practice today are mostly effective for working with the majority of clients, and substantial number of people who seek services simply did not get what they need. One reason for the needs of some ongoing unmet has to do with the origins of the theories themselves, which were created by educated middle and upper class European American males whose political and cultural values may not be relevant to other cultures' values and ideologies. Although cultural awareness and sensitivity training are now required for many college and graduate degrees, education can only do so much to influence the behavior of human services professionals. Sometimes organizations themselves prevent workers from providing culturally effective services because the organizational culture doesn't promote cultural sensitivity. Culture then is referred to an individual's values, beliefs, explanatory system, and behaviors learned in the family or social group. Gender issues. The responsibility of every human services worker is to become aware of the importance of gender issues when assessing a client's needs. Gender-biased stereotypes need to be identified and challenged should gender be a factor for the client. So you must consider the following when working with women. There's a long history of sexism against women, such as the objectification of a woman, and there are many crimes of abuse and violence against women, such as rape, domestic abuse, child abuse, and slavery. And we also need to consider there's also reverse sexism against men, where men may be more vulnerable than we think. As you learn more about human services profession, your education will explore gender on a deeper level of identity, cultural influences, and definitions. Sexual orientation issues. The fear of discrimination and at times violence has forced many gay, lesbian, transgender, and bisexual people to hide their true sexual orientation. Leading such a life is referred to as being in the closet and often causes feelings of depression, shame, guilt, and fear. Such people are always vigilant and anxious about having their true sexual preferences discovered. Various social biases create a climate that inhibits homosexuals from living openly. Heterosexism is the belief that the only proper sexuality is between females and males. Is probably the strongest bias that influences societal rejection of homosexual behaviors. And some people's fear of gay men and lesbian can manifest itself as homophobia. It's an irrational fear about being around, touching, and liking homosexuals. Ethnicity. Human services workers should consider cultural values and behaviors that might differ from the mainstream culture when developing interventions for clients whose ethnicity differs from that of mainstream America. The best advice is to listen carefully to each client and family, ask questions about how culture may be influencing a client's needs, and explore options that don't impose conflicting values onto the client. We must also explain to some culture the practical issues of assimilating to American culture and reasons for various American laws. Here are some cultural issues that you should be aware of when working with various cultures. For Asian Americans, studies have shown that Asian Americans tend to be less expressive and more restrained than mainstream Americans. They value control over emotional expressiveness. This differs from mainstream American culture that expects people to openly and directly express affection and other strong emotions. Arab Americans. Studies have supported that counseling and other social services can be more effective with the support of community religious leaders. Middle Eastern culture is a collectivist in which community acceptance is important versus American culture that values individuality. And they do not challenge the patriarchal position of male family members. African Americans. The most important issue to keep in mind when working with African Americans is racism because of their long history of dealing with racism, especially institutionalized racism where we can find an overabundance of racism in the criminal justice system. However, there have been some strides towards visible representation, such as President Barack Obama and other political leaders in the federal government. However, African Americans are still underemployed due to racism. It is also important to note that religion is important to the African community as well. Native Americans. Most Native Americans live with their extended families, and as these families relocate away from the reservations and to urban settings, they face a constant struggle between keeping traditional culture built on spirituality, socialization, and language, and adopting mainstream values that emphasize competition and independence. In living outside of the government constraints, many may not seek services or none are available to them. They lack access to these services, there's a language barrier, and there's no interpreters and no sufficient trained human services worker to work with this population. Religious issues. Many human services workers have found spirituality helpful to clients' overall well-being. Spiritual issues has a place in therapy because human beings are spiritual by nature. So it's important that you don't impose your own religious values onto your client, but to help them explore their own religious beliefs or spirituality.